Hello, everyone. Thank you for joining us. We are here interviewing Christine Devine, who is the wellness specialist for Michael Garron Hospital in Toronto. Welcome, Christine.
Hi, Liz.
Thank you so much for joining us today, Christine. We are so grateful for you to share your expertise. We know that in this particular time when the world is dealing with this pandemic, that the people who are working the front lines in healthcare are absolutely putting their all into it. They are working tremendous hours. They are working in very difficult conditions. And what we would like to do is help to share some of the best practices and expertise and maybe some of the learning with each other that can help other organizations within healthcare and other organizations who may also be dealing with some of the same sorts of questions. To help them kind of navigate through this in a way that is going to help to support the psychological and physical health and safety of workers. So I'd really like to thank you for this interview and be very respectful of your time and help you get back to your workplace. So I'm going to run through just a couple of questions a few questions with you. And feel free to answer them however you see fit. And we look forward to helping to share this good information with people. You know, we know that this is a very difficult time for everyone and that healthcare workers are on the front lines. Can you please help to put into context the challenges that the response to COVID-19 is having on the mental health of staff?
Sure. I think we can look at what has happened elsewhere in the world and kind of assume that the challenges are the same. But being that we are Ontario and leaders of healthcare, there are other challenges that go from a system-wide perspective to an organizational perspective to an individual perspective as well. And the situation has compounded workload, thoughts and approaches to personal safety, the idea of uncertainty and how we reassure people that we're making the right decisions to suit them in the moment and keep them safe physically and psychologically are all approached with a changing speed like we have never experienced before in a very complex system where it's not really easy to get answers in real time most often. And so I would say what I hear from my folks and my peers and colleagues at work is, how do I calm my team down? How do I assure them that, yes, this is going to be difficult, but we're going to get through this together? And from the front lines, I hear, what we're hearing about in the news. Am I going to have a mask and a gown tomorrow to be able to go into a room and serve somebody of my community who's suffering in the right way? So very, very challenging. And in broad strokes, really looking at a system that works lean anyway, the added workload to people, understanding and communicating the expectation that you don't need to be on your email 24/7. This is a marathon, not a sprint. We need you to look after yourself. We need you to conserve. And to understand that when you're on the premises, absolutely, people are operating with great dedication. But when you're away from the premises, you need to spend time with yourself. You need to reflect. You need to be with your family. And then there are imposed restraints there. People are dealing with childcare issues. And it doesn't matter if you're frontline or you're administrative. If your kid's been home for 3 weeks at this point, they are challenging in terms of being bored, not knowing what to do, wanting to go out and see their friends, not really understanding the consequences of you know, of leaving the house or breaking their own bubble, I guess is the new phrase that we're using, right? So multiple challenges for folks.
Okay, thank you. Yes, it's we're dealing with the kinds of issues that, as we were talking about earlier, that we've had some experience in dealing with epidemics or other crisis situations that may have affected communities, but not necessarily something that has affected the entire world outside of world wars, of course. But this is something that is affecting pretty much every country and every person. And so, yes, these are common issues, but the issues that you're dealing with within the healthcare organizations, I think the sense of urgency and just the nature of the frontline work and workers putting themselves at risk every day is just heightened in comparison to maybe what many others of us are dealing with. So we do thank you and all of the healthcare workers. Now, the next question. Leaders in healthcare organizations are facing some serious issues as they grapple with the impact of COVID-19. And while this is happening, healthcare workers may be feeling nervous about what's going on behind closed doors. What advice do you have for leaders on how to calm the nerves of healthcare workers?
Yeah, so I mean, we, like every other organization, experienced this in the first week when we were forecasting and starting to plan what's the next step the government's going to take, how do we respond as an organization. And there was a lot of planning going on in different working groups around the organization. And so the regular faces that frontline staff normally see were not available initially. And although everyone understood that this was to prepare us for what's to come, there was almost more nervousness that resulted from it. Like, why are these people not available to me? What's happening behind that door? And one thing I've always said about Michael Garron Hospital is has always been an open door policy there. And so I went into the chief nursing officer's office one day just before their daily executive meeting, and I said, hey, here's what I'm hearing from people. They're really worried because they're not seeing your faces, and they need some reassurance, and they need to know that if you're in the vicinity, they're going to be able to ask questions and get answers that they need. And so we talked about how we could, beyond the other communications that we were sending out, how we could rectify that. And I got to tell you, that happened at 3 o'clock one day, and at 6:30 a.m. the next day, there were members of the senior team at our staff screening station, welcoming people into work, saying good morning to folks, and that is now a regular practice. So there are members of senior leadership at the staff screening station in the morning when people come in to start their day, and then in the afternoon at shift change. So they can say goodbye and thanks to folks, and they can welcome the evening shift in. What a difference that has made in terms of letting people know that leadership is available. Other things they're doing, constantly rounding, particularly evening weekend shifts, which don't normally see leadership. They have paired dyads that go around to different units and just make sure that they are fielding the questions and concerns from teams and answering as best they can with the most up-to-date information, what we're doing, why we're making the decisions we're making, why we're putting these practices and procedures into place. And I think it goes a long way. You can't lead with blind reassurance at this stage. You have to be really open and honest and transparent. And that starts with being physically there in front of teams. So I would say there are many, many ways that we have done that, in addition to very consistent daily updates from our doctor who's in charge of infectious disease. So he's in charge of our infection control team, Dr. Powis. He and our CEO send out a broadcast message at least once a day talking about the state of the nation. What's happening internally? What are the changes in procedure? What do we need to do in order to, or what do we need to understand in order to feel safe in the work environment? And so that's updated as needed, most normally end of the day, but you can come into work with a new update as well. They've also put in place an email web address where you can send in questions. So we have a video sent out to us today, the latest 5 questions from staff about their biggest concerns. And Dr. Powis and Sarah Downey, our CEO, answered all of those in a video chat. Really informative. And it's pushed through our iLearn system, so our internal organizational learning system. So everybody is given a link to check in and be able to view this at their own leisure.
That's fantastic. Can you, a couple of really amazing ideas in there. Can you give us an idea of what impact these initiatives have had on lowering the stress levels of staff? What kinds of things are you seeing with staff?
I don't think it has alleviated stress, because I think people are getting too much input from outside of the hospital too, you know, with news and social media. I think what it has done is allowed people to feel that that stress is a normal part of a completely unprecedented situation, which is very important. Normalizing and acknowledging stress, anxiety, fear is a really important thing for us to do with our colleagues, no matter what level of the organization you're messaging from. And I think what it's done is it's made it okay to talk about it. And so right away from the very beginning, we were messaging people through broadcast emails about, you know, the idea that it's okay to not be okay. It's okay to have some pretty big fears about this. What you do with that fear and how you gain the knowledge to be able to make the best decisions for yourself, to take control of the fear, is entirely up to you. And in promoting connecting with each other, asking questions, opening up conversation about really tough topics and things that we think we might endure in healthcare has been, I think, very helpful.
Mm-hmm. Mm-hmm. That's good. And that's a very good point. It's not a matter of reducing the stress, because these are very stressful times, but it's helping people to be able to cope with the stress in a healthier way, perhaps.
Yeah, and I think one of my personal mentors, Dr. Peter Jensen, calls it energy management. He doesn't really use the word resilience the way we in healthcare, we like to throw it around, right? But he talks about energy management. How are you going to manage yourself over the next 6 to 8 weeks as we go through this, and to ensure that you will be able to endure the full distance? And, you know, healthcare professionals are really, really dedicated folks. They put themselves first. They don't feel comfortable looking after themselves if somebody else is suffering. Like, that's intuitively and instinctively, that is their first concern. So how do we get people thinking about managing their own energy for the long haul, right? Not just today during the shift, but in the long haul.
Now, when we were talking before, you had mentioned that healthcare workers are on the front lines. They're dealing with some very difficult circumstances and decisions. What should they be doing to care for themselves and to protect their mental health throughout this time and with the circumstances and those difficult decisions that they're having to make? And what has Michael Garron Hospital done to kind of help them?
Yeah, so I mean, we have some concerns right now about capacity for the entire system and the types of decisions, care decisions that have been made in New York and Italy due to lack of resources, lack of supplies. So we know that it's a possibility. We might have to make decisions that would not normally be um, would not normally be the course of action. So there may come a time when we ask clinicians and physicians to move from a place of advocacy for the patient to and become a steward for resources. And that is going to leave uh, a lot of people in a deficit emotionally because it's not the way things are supposed to be. So we are putting in place, and part of this is across the system and being suggested as best practice and legislated by the province. But we are putting together a decision-making ethical framework that does not allow people to feel the responsibility of or execute the responsibility of decision-making on their own. There will be many people involved. We have collaborated with our director of mental health to leverage our in-house experts, our mental health therapists, our psychiatrists, so we can expedite anybody who needs to have some counseling after a particular shift and the events of a shift. We can get them into our own resources quite quickly. We have spiritual care team members who will be on the floors. And hopefully, we're all in the planning stages right now, but hopefully will be augmented and supported by social workers and other people with therapeutic training skills to help assist patients, patient family members, and our staff members. Really important too to think about what's going to happen in the 48 hours after a difficult shift, who's going to check in with these people, how are we sending people home. So do we have a check-in at the end of the shift that says, hey, are you okay to drive? This was a difficult day for you. Is there anything you want to talk about before you leave? Is anybody home, or are you going home to an empty house? We have employed a buddy system amongst our physicians. So our division heads are going off to their teams and saying, we need to have a buddy system. I want you to align yourself or have me align you with a colleague that you can check in via text at a mutually defined time with certain questions to ask. How are you doing today? What was the last 48 hours for you like? Do you need any support? Questions like that so that they can support each other. And if the questions don't come back in the positive, we can send them for further support to our in-house experts.
With respect to other workers in the healthcare organizations, I mean, we know that there's the doctors, the nurses, and they're frontline, but there are other workers who are also working in the hospitals as well. People like housekeeping staff, the people who are working in the kitchen and the laundry and the food delivery. What advice do you have on protecting the mental health of these types of other staff who may also be feeling the effects of this?
Yeah, well, we can't forget about them, right? Like everything on the news and everything on social media is doctors and nurses and doctors and nurses. And if you talk to the doctors and nurses, they're the first people to say, I am not an island. Look at all these other people who support me and make it possible for me to do my job. And so I think, you know, we have begun a practice of teaching people a very simple model of checking in with each other for peer support. And we are teaching that model in daily huddles. So I'm going around with my human resources business partners to each of the different departments and talking to folks. letting them know that we're here to answer any questions that they have, that we understand how important their role is and how we get through this, that their fear and anxiety is real and needs to be acknowledged, and helping them to set up little check-ins amongst each other. So we're really making a concerted effort to include everybody in our communications, to show up face to face. And it goes to the other end of the spectrum too, you know, when the units that are going to see the most patients and have the most action, so to speak, they don't think anybody wants to come up and see them. They think, you know, it's a scary place to be. So it's even more important to show up on their units and say, hey, how's everybody doing? And when we huddle, there are folks from other departments like environmental services, like food services, who are up there. They get included in the huddle too. I'd say too, like the shout outs from the doctors and nurses and the communications from our doctors and nurses have all been so inclusive. Understanding and communicating that the role of everyone in the building is so integral to how we meet the needs of our community. So I think we do a good job at that, and it's just a case of thinking, I'm going to proofread this before I send it out, or is there anybody in the building I haven't connected with, or just reaching out to your managers and saying, how are your people doing? Do they need a visit? Like, what can we do for them? And the ideas will start to flow.
You had also mentioned the other day when we were talking that that your organization is also starting to look at what healing will look like after COVID-19. Can you expand on that a little bit?
It's the next challenge, right? Which we need to really sort of dissect and think, how are we going to, without knowing and only being able to forecast and plan for the worst and still hope that we're never going to get there. What does healing look like after a situation that has the potential to fundamentally change who people are at their core? And I don't know if we have any answers yet as to what that looks like. There will be some conversations with different areas of the hospital, including spiritual care, because they have a psychotherapeutic training and trauma training, and with some of our professions who can lend expertise in that way. We're going to look at different round models like Schwartz rounds, or our friends at a peer hospital have what's called artichoke rounds. It's called getting to the heart of the matter. And it's really an opportunity for people in a safe space to unburden themselves emotionally, which we think is going to be the greatest need. And I would say, you know, these rounds, which are typically, you know, in a hospital, we have grand medicine rounds. They're typically attended by physicians and residents. These rounds, these open forums, these sort of grand debriefings will be open to everybody. So it will be a safe space, but our cleaning staff, who, you know, we have porters, so people who move patients from one area to another, who are on the Code Blue team, who are actively involved in Code Blues. They see things that people with clinical training should see, right? They witness things that normally a cleaner in any other organization wouldn't see. So how do we support them? How do we help them process? And acknowledging that it's going to be more than 2 or 3 rounds of debriefing or forums for debriefing. It's going to be ongoing, reflecting, giving people the opportunity to express what their experience was, what the process is like for them in trying to deal with the residual effects of it, and how do we take that experience and formulate a new way of doing things so that next time we don't have the impact, that this is going to have on folks. The uncertainty is difficult because to a degree you feel helpless. It's like working from home. Everybody feels a duty to be in the building. It's wonderful to be able to work from home, but you're here thinking, I need to know what's going on. And so that's part of self-care too, right? Is giving yourself permission to half an hour, 1 hour every day. You don't pick up your device. You understand that the organization does not require you to be accessible 24/7, and give yourself a little bit of that space, because that's the only way you're going to make it through 2 months of this, 3 months of this. Mm-hmm. We don't know what the models are going to show.
So let's talk about the home scene now. So, the healthcare workers, they go home after their shift. Sometimes they've had a very long and difficult one. So some of them are going home to families, others are going home to empty homes, and it's just themselves at home. How can we help them with their off-the-job mental health? So let's talk first about those who live alone.
The challenges right now, because we're all, if we're doing the right thing, we're living in our own bubble. And so how do you leave a shift and carry everything from that shift, plus, the regular anxiety and stress about COVID in general, home to an empty house? And I think really trying to structure your time at home is important. So do you have a ritual at the end of your shift that allows you to leave that work behind? A lot of people, we carry lanyards or we wear lanyards. A lot of people break their lanyard off. They have like a release clasp. They break that off. They fold it up. They put it away. And that is the end of their day. They have trained themselves to understand that that ritual is work to be left at work. And then they start to move into their transition time to get home. Utilizing transition time, right? So if you're on the TTC, what are you doing with that time? Are you listening to podcasts that really interest you? Are you reading books? Are you doing something that is just for you in that kind of time that is really hard to use in a fulfilling way, right? We're really lucky now. We have all kinds of technology that can support a little bit of our time in a streetcar or in a subway train. So how are you using transition time? What happens when you wander through the door? Does everybody bombard you? I can remember my dad, who was not in healthcare. Every time he'd come in the door, he'd say, I'll be with you in 15 minutes. And he'd march up the stairs and he'd have a shower and he'd change his clothes and he'd come downstairs, and then he would be present for the family. But he needed that time, and we knew it because we had talked about it. So I would say talking with friends and family about what you need, even if you're at home, right, by yourself. If the phone rings, are you going to get it, or are you going to let maybe your neighbor or your family members know that you're working till 6, you're going to need till 7 to just chill out, and you'll call them at X number of hours. Take charge of that opportunity to connect with people, but do it on your terms, because you've just given away so much energy all day. You need a little bit of time for yourself.
Mm-hmm. Very, very good advice. Very good advice. And how about those with families? But people are coming home and they're dealing with their spouses, or they're dealing with their children. And some people are also caring for their parents who are maybe living with them as well, or others. What advice would you have for those folks who are going home?
I would say be very clear about what you need. If you are looking after elders and they're not in the same building, I had a friend say to me that she had texted her mom and dad and said, is if you guys need groceries, you're not going out. So you either give me a list or you get what I bring to you, which you might not like. so so she really took charge of the situation, and lo and behold, in a couple minutes enrolled a text with a list of things they wanted. And so she was able to get on that. Being clear with your family that you're going to need a little bit of time to just shower and take the day away. When you get home, change your clothes, and then you can be present at the dinner table. A reality with healthcare, and particular people at the front line, is at what point do I have to start isolating myself from my family? Mm-hmm. Right? So how do we communicate the new norm to kids? How do we still maintain that connection without touch? You might be living at some point in the next couple of months, you might be living in the basement and everybody else upstairs. So how do you connect and still take time for yourself? I think the idea of ritual needs to be carried home too. So we have some folks who have experience working through SARS, who are experiencing the same manifestation of behaviors, protective behaviors that they exhibited during SARS, and trying to flip the perspective of, I'm showering again because I don't want to infect anybody, to I'm going to go have a shower because it gives me 15 minutes in a nice, hot, steamy, luxurious environment to let the day wash away, so that I can think about what tomorrow is going to bring, come up with some good, ideas of how I'm going to meet the challenges of tomorrow. Think about questions that I want to ask my kids and my spouse and people I want to connect with, and then get on with the evening. So reframing why we're doing things. Mm-hmm. It's funny because in talking with a lot of people with kids, on a good day, they're still doing things for their kids that their kids could do for themselves or the household. So if your kids are of a certain age, start delegating. If they can make dinner, have them make dinner. If they can do dishes, have them do the dishes. It's about teaching everybody that they can be a part of a working household in times that are different, that require more effort.
And that's important because everybody at home needs to feel that they are valued and useful as well.
Yeah.
And that helps with that. And so when a person is at home and they're trying to be present, so often the mind will wander, and it may wander back into the workplace. What advice would you have for people on how to bring themselves back and how to stay present?
I mean, there's a million different research papers on the power of breath, right? Breath work, being still, being quiet. We shy away from those moments as humans because that's when the emotion will bubble up. But really knowing that that's part of healing, that's part of processing what's gone on during the day, being able to understand that those moments of silence that work with breath and really slowing the body down does two things. It helps us nurture the parasympathetic nervous system, so all of our rest and digest that goes on physiologically. And it also helps us to practice self-awareness so that when we go back into the workplace tomorrow and something brings about a fear or an anxiety that I feel the need to express, I know when I come to you, Liz, and ask for a debriefing, I'll know whether it's just for venting or because I really need to process something, and I'll be able to express that when I come to you initially before hammering you over the head, right? Which is sometimes what we do. We run down the hall and we go, this is what just happened. And we think we're debriefing, but we're really just blasting somebody. Mm-hmm. And so mindfulness and that quietness and that practice with the breath really helps us connect with, am I venting? Am I sad? Am I anxious and scared? And once you can articulate that, then you know who to go to help you through and to get the answers.
right
And
now.
and what we're feeling right now in healthcare is anticipation anxiety, right? Waiting for the shoe to drop. Okay, when's it going to happen? We're doing all of this upping and skills training, and really trying to prepare people for what we're seeing elsewhere. And now it's like, okay, so at what point between learning the skills and actually employing the skills, like what happens in between? And is there enough time to keep practicing? Will I know what I'm supposed to do when it gets to this point? There's all of that
Mhm.
sort of anticipation about how's this going to look. And there's so many moving parts, so many variables. We have to surrender to it to a degree. We can plan, we can communicate, but we have to at some point surrender and just say, all right, we're going to be ready to roll with it.
Christine, we got in touch because we had done a webinar previously together where you had talked about the great job that Michael Garron Hospital has done in implementing the National Standard of Canada on psychological health and safety in the workplace. Could you comment a little bit on how you think the implementation of that standard may be helping to cope with this situation?
I think we were the right organization to take on the standard very early in its origins, because we had a leadership team that was very aware of the uniqueness of healthcare and the depths to which people in healthcare will give to their community, to their patients, to their patient families. And I think so. To that degree, we were very fortunate that it took no convincing whatsoever that this was an important thing, and also the recognition that we started this work because of a high incidence of violence in the workplace in healthcare, and recognizing that there's no violent incident that doesn't have a psychological component to it. So in thinking about that and just trying to branch out and understand what the needs are of people in the healthcare environment on a day-to-day basis, as well as long-term, because we want people thriving in their roles. We want them to work with us until they retire. And in most cases, we do. In most cases, we have people that are working into their 70s because they love what they're doing and they feel good about what they're doing. But in exceptional times like this, having that culture and that roadmap of actions to take and ways to communicate and skills to develop on a daily basis is a really good foundation to jump off of in moments of crisis like this. So I think it has helped us as an organization understand who needs to be at what tables, to understand the stresses that our teams are going to encounter, what their needs, anticipate what their needs might be, understand what the fears are so we can provide the right information, the right training, the right supports. I think it has expedited our response to this. Even though there's still so many unknowns, the goal is to anticipate everything we possibly can to understand what the end of this might look like and support people all the way through. And we're going to drop a few balls. We're going to learn a lot along the way. But I think we've set it up where people can come forward and go, you're not thinking about this and you need to think about this because this is going to be a big deal. And then we can say, okay, tell me some more about that. Give me the information I need to take this to the appropriate people and figure out what the next steps are. And that's already happening all over the organization.
And then as we first came on to the recording today, you were mentioning that you've had some additional conversations with leadership and some of the things that they're considering. Would you mind just going through that again, just to
Yeah,
say,
sure.
here's the things that they're looking at, and because clear leadership, setting clear leadership and expectations is one of the 14 workplace factors. And in times like this, I think it's a very, very important workplace factor for the reasons that we talked about earlier.
You know, what our leadership does really well is uh, empathize with the individuality of staff and what they might be experiencing. So when I asked my boss, I said, you know, what are some of the things you're really concerned about with people? Right away, it was like, you know, this is so complex. It's such a compounded situation. Are we giving people enough information so that they understand why we're doing things and feel safe and secure? The extra workload, you know, we already are doing things off the side of our desk in healthcare or working short on a unit. What happens 3 weeks in when, you know, X percentage of our staff are off because they're not well? How do we help people with that extra workload? Physical safety becomes a real priority when you're dealing with a virus. So how do we ensure that? How do we communicate what the best steps are on a day-to-day basis as protocols change? And how do we consider financial impacts? I mean, in healthcare, we're very lucky. We're all needed right now, but it might not be the same for everybody in our family. We might have a young adult who's lost their job, who's coming back into the household. We might have a spouse who is either working from home or has been laid off, or we might have a spouse who has a small business who has had to shut their doors. So we're really trying to understand and anticipate some of the stressors that are on our folks, and to really be compassionate in our approach. Yeah, we need you to show up. We need you to at the bedside. We need you to help out. But we also understand that you have a whole life outside of this place that requires your time and attention and energy. And so how can we help you balance these things? Even if it is just acknowledging that you are scared, you know, if that's the least thing we can do, how do we build on that to support you?
Are there specific tools that you're using to kind of like checklists or anything that you're using to help to manage through this time that you'd be willing to share with other organizations?
Absolutely. I mean, some of the things that you can find online are the COVID-19 therapy hotline. So it's free to any mental health or any healthcare worker. Um, and I can't remember the name of the site, but I will get it for you. You can sign up and you have access to a mental health counselor. It's free. I would say the Mental Health Commission continuum of health. We use that in all kinds of teaching. So understanding, where am I at today? What are the behaviors that I'm experiencing? And what do I need to do if I'm not sleeping well? If I'm starting to understand that, oh, I'm isolating myself from other people, which, yes, we're supposed to be doing, but only physically, not socially, spiritually, emotionally, right? So we use that, the mental health continuum. The Working Mind also has a really great resiliency guide. And we have some other really cool video clips, 1 minute, 3 minute, 5 minute meditations that we've posted on iCare, which is our intranet site. Some hotlines for physicians, for other professional groups. So it's out there, like everybody in healthcare sharing, oh, have you found this? Have you found that? Do you have this? So there's lots of sharing going around. We have leveraged our in-house experts, our social workers, our mental health therapists, and we've asked them to write blogs. How do we support our kids through this? What happens when you live alone? What happens if you get tested and you're awaiting your test results? What's that feel like, and how do I manage the anxiety? And they have been stellar in terms of supporting our wishes for sharing information and coping strategies. So if you have the in-house experts, go to them first, because most likely they're a familiar face for your staff and colleagues.
Is there anything else that you'd like to add?
I'd just like to say that, you know, my origin of work in the hospital was always in the gym. And I recently overheard a lecture from Dane Jensen, who was talking about the ability to remain resilient and to bounce back and to respond to stimulus. And oftentimes, when we are trying to develop a skill, we will challenge what we aim to develop. So if I want to, in the gym, make somebody balance better, I will put them on an unstable surface and I will poke at them so they wiggle and wobble. And it's not so that they fall down or so that they prevent falling. It's so that they can respond to changing stimulus in the moment, right? And we train that, and we train, oh, it's not that bad. It's not that scary. It's actually can be quite exhilarating. So I think when we talk about resilience and looking after ourselves, we have to recognize that things are going to be coming at us mighty fast from all different directions. And it's not that we don't fall. It's not that we don't cry. It's not that we don't feel affected. It's that we know how to manage it, who to go to, how to rely on our friends and our family and our colleagues to manage it. Because the reacting to the stimulus is what makes us human. And we cannot lose that in healthcare. And we can't lose that in our communities.
Well, thank you so much, Christine. I really appreciate your time in this interview, and all of the work that you and the others are doing. Our hearts go out to you, and please keep in touch.
Thank you. It's been a pleasure and an honor to represent my people who are amazing.